Hi, good afternoon, everyone. My name is Bridget Skelton, and I'm a registered nurse with CaraViita Home Care. And today I wanted to bring a little short video to share with you a little bit about the different types of precautions and the advice out there about the different types of masks that are being advised for people to wear. So number one, how does this COVID-19 virus, how is it spread, typically in the community setting? Well, we have talked a lot about what the CDC recommends with hand washing and appropriate personal protective equipment, but what does that actually mean? Well, the virus, the COVID-19 virus, is typically spread through droplets, meaning if someone coughs, sneezes, or touches their eyes, nose, mouth, face, and comes in contact with those droplets, and then they touch a surface that you then go and you touch that same surface, and you touch your eyes, nose, and mouth, you could become contaminated with the virus. Also, if you become in close proximity, not maintaining social distancing and less than 6 feet, and they cough and sneeze into the air, even if they don't know they have the virus, if they think it's just seasonal allergies, right? And they start coughing and sneezing into the air, and you come in contact with those droplets, and they do contain the virus, then that is a portal of entry into your body. So that's why the CDC recommends the surgical masks for people that are initiating droplet precautions, right? And taking care of someone in an assisted living or in someone's personal home. If they have respiratory symptoms, you'll want to wear a mask, and you want your client or your patient or your family member to wear a mask. The theory is my mask protects protects you. Your mask protects me, right? So if we both wear a mask, if I'm coughing and sneezing, it's going to go into my mask. It's not going to go into the air. So that protects you. The same token, if you are coughing and sneezing, it goes into the air. That will get into my eyes, nose, mouth, and lungs. So if you're wearing a mask, it protects me. Now, what is all this talk about the N95 mask and aerosols, and what does that mean? Well, this virus is contained in a droplet. But when you do a procedure that makes it an aerosol, it's called an aerosol generating procedure, then it does become a tiny little particle that needs a special filter in a mask like an N95 mask, because it can go into the air and be breathed in even beyond 6 feet and linger there for hours, right? So that is when the N95 mask comes in handy. That's when you want to have the N95 mask. So what generates aerosols? In hospital settings and clinical settings, it's typically mechanical ventilation, deep suctioning, any type of procedure with a high flow oxygen or positive pressure, where you're going to come in contact with an aerosol mask. Also, in a home setting or an assisted living setting, sometimes you may have CPAP patients or a person wearing a CPAP machine. Because of that positive pressure, it can generate some aerosols, and also nebulizer treatments. Some things that don't cause aerosols are oxygen, regular standard oxygen on a concentrator with a nasal cannula, and inhalers. They do not cause aerosols. But nebulizer treatments and CPAP machines can. So that's when you want to think about, if you're going to be coming in contact with someone doing those procedures, you want to consider wearing that N95 mask, because that is when it does become an aerosol and can get in between the gaps in that surgical mask or under that surgical mask. You also want to make sure for both precautions that you're doing proper hand hygiene, hand washing, and you're also wearing eye protection during that. So that is the difference between the different types of precautions, airborne precaution versus droplet precaution. If you have any questions or you want to reach out for further clarification, feel free to message me. You can email me at bridgets@caravita.com. You can also call our office. And all of this information is also found on the CDC website. One of the reasons I wanted to do this video is to prevent the overuse of N95 masks unnecessarily, and use up the supply that our healthcare providers in a hospital setting need. It is very important that they have their N95 mask, because when they come in contact with those aerosols, they can breathe them right into their lungs, and that's when they can become infected. And if our healthcare providers are infected, they're going to infect everybody else that they come in contact with. So it's very important. This is our social responsibility to understand how personal protective equipment saves lives, how it protects you, and how it protects me. Again, my mask protects you. Your mask protects me. Thanks so much and have a blessed day, everybody.